Are you guys tired of me yet? Alright, second video, Sunday. Okay, so I did forget to mention some stuff on my last video. I'm not sure if some of you may know this, but when you have plastic surgery, you lose sensation in certain areas. Like, for instance, and some of you may know this and some of you may not know this, but you lose your sensation around your nipples and around your areola. So I have like no sensation at all there. And as a person who liked that area, you know, and was sensitive around that area, I no longer have sensation there. Now they say that it takes anywhere between 6 months to a year. I'm not sure if that's correct. Like I said, I did have a girl who lived upstairs from me, and she also had her plastic surgery over there in Colombia, and she had breast implants as well. She never got her sensation back, and she's 3 months post-op. However, they did say that it will return like 6 months to a year, so let's see how that happens. So far, nothing yet, and I'm 4 months post-op. Can I tell you, if I don't get my sensation back, I'll be devastated. Another part where I don't have sensation at is my lower stomach, and that's where my tummy tuck was performed. I really can't feel anything there, so if you like poke around or like probably pinch me with a needle there, I can't feel it. The last time I had a feel-iter, usually I could feel it, you know what I'm saying, like the pinch or the needle. Totally did not feel that part when they moved the needle around. So I guess that's a plus, right? But it does feel a little weird. As you know, before all of this happened, I had a huge problem where I had to probably get like a port revision because after losing so much weight, approximately 125 pounds, 123 to 125 pounds, my port was literally like sticking out, and it was like really bad, to the point where it was so bad. And sorry to be so blunt, but you know me, I'm always blunt. Like, even if me and my husband was having intercourse and he was like tilling on top of me, I would push him off because of the pressure and because it was sticking out. And it was weird because like I guess like when I would eat, it would stick out more, if that would make sense to you, but it was like totally true. It would like poke out even more, so it was like really bad. So when they did go in, and one of the benefits of going out there was that they did, and I'm talking about Colombia, when they did perform the tummy tuck, they did move my port, and it was moved like 2 inches above my belly button, right in the middle. When I had my revision surgery for my tummy tuck, after the fucked up surgery they did over there, it did bother me for a while, I think for like 2 weeks, and I was curious to find out if they moved it again, because I was like starting to feel it and stuff. But I think after the 2 weeks, you know, he did confirm that he didn't move it, because I would have been devastated again if I would have felt that again. Because you do not want to feel your port. I mean, like, you'll feel it or whatever, but like it gets bad when it like really pokes out to the part where you can see it and where it really gets uncomfortable. So yeah, he confirmed that he didn't move it and stuff, and then after 2 weeks, like, the port just like stopped bothering me again. So I'm happy in that area where I had the port moved and I can no longer feel it. What else? I was gonna say something else, and then like when I start thinking, my thoughts just get all gibberish. Let's see. I'm gonna say something really private, and I'm like, or whatever. Also, when you lose a lot of weight, some of you might be curious or whatever, your private area or whatever like goes down as well. So mine's like went really down, because like being overweight is just like having this fat stomach. It's just like your private area grows too or whatever. So that goes down. If you guys are curious to find out, So I think with the tummy tuck too, it even went even more down. So I'm happy with that. One of the disadvantages of having revision plastic surgery and being on so much antibiotics too is, again, being straightforward and blunt. You start to get infections, and by infections I mean like yeast infections as well, which is very common when you're on heavy-duty antibiotics. So I also went through that twice. Once in Colombia, and then again with my revision surgery. Again, it's very common. You can ask any doctor when you're on heavy-duty antibiotics for you to get those types of infections, and that's another thing why I was miserable for a long time, because with the pain of the tummy tuck and then the combination of having a yeast infection, I was like completely miserable. And I think that lasted for about 2 weeks, and I was like so happy when it was gone, because I was like, oh, it was just horrible. Let me see what else. I think, yeah, that I'm pretty much finished. Coming here straightforward. Oh, yeah, when my doctor, Peter Newman from Long Island, New York, he did my revision surgery. He couldn't really mess a lot with my sides, because, as you guys know, the 2 infections that I had, which were fatal, he couldn't really play too much around that area, so he couldn't really, like, you know, go down all the way, because he wanted to prevent, you know, more like he didn't want to spread the infection, and he didn't want to create more of an infection. So he didn't really pull the sides straight, you know, at like what he would normally do. And he did give me the option to go back within 6 months and like do it right. I'll show you. Alright, so you see here, like, oof, the lighting is bad here. But I still have like extra skin here. I mean, it's not bad, like, it's not really that bad, but I still have like extra skin. If I was to sit down, you would see it more, you know, like I would have, you see? That's like supposed to be like all gone and stuff, and because of the infection that I had, he didn't really get to pull the skin down the right way, and he did give me the option of coming back within 6 months, you know, if it didn't go straight, you know, if it didn't go down the right way, because he couldn't pull it down the right way because of the infection, to go back within 6 months so he could redo it. Right now it's something that I'm thinking about. I would rather work it out. Currently not doing exercise, even though I would love to do exercise, because that's just me. I love to do exercise. I would love to work out on my own. I'm probably gonna weigh it out. I'm gonna start exercising, you know, when I'm 6 months post-op, and my plans are to like get abs, like, you know, just try to get ripped a little bit, like maybe have like a little 4-pack and whatnot, because I know that I could do it. But those are my plans, and if I could do it on my own, then I would, and not have to have another type of surgery just to bring that down. I mean, it's not a big thing. It is noticeable, like I said, when I sit down, but it's not really a big thing. As far as the scars, like right there in my belly button, you see that V scar? The lighting is bad again. Which they messed me up over there again, like you guys all know, in Colombia. My plans for that is either to get it laserly removed,